Dengue fever is a viral disease caused by the dengue virus, mainly transmitted to humans through the bite of infected Aedes mosquitoes. Malaria is a parasitic disease caused by Plasmodium parasites, transmitted to humans through the bite of infected Anopheles mosquitoes. Both can begin with a fever after a mosquito bite, but one is caused by a virus while the other is caused by a parasite. So, how are these two diseases fundamentally different? In dengue fever, the dengue virus enters the body and can cause high fever, headache, muscle and joint pain, and in severe cases, bleeding and shock. In malaria, Plasmodium parasites enter the body, develop in the liver, and then invade red blood cells, causing episodes of fever and chills and potentially damaging multiple organs. Dengue fever occurs when the dengue virus enters the body, mainly through the bite of an infected Aedes mosquito. Malaria occurs when Plasmodium parasites enter the body, mainly through the bite of an infected Anopheles mosquito. Both originate from disease-causing organisms transmitted by mosquitoes, but the pathogens behind them are completely different. So, what causes people to develop these two diseases? Dengue fever begins when a person is bitten by an Aedes mosquito infected with the dengue virus. The virus then multiplies in the body and causes disease. Malaria begins when an Anopheles mosquito infected with Plasmodium bites a person, injecting the parasites into the bloodstream and starting the infection process. The pathogen that causes dengue fever is the dengue virus, which has four main serotypes: Dengue 1, Dengue 2, Dengue 3, and Dengue 4. The pathogens that cause malaria are Plasmodium parasites, with Plasmodium falciparum being one of the most dangerous species to humans. One is a virus while the other is a parasite. So, how do these two pathogens differ when they enter and attack the human body? The dengue virus primarily circulates in the bloodstream and affects the immune system, blood vessels, and blood-clotting processes, potentially causing bleeding and plasma leakage. Plasmodium parasites go through several stages of development inside the body before invading and destroying red blood cells, producing the characteristic cycles of fever and chills. Dengue fever is primarily transmitted through the bite of an Aedes mosquito infected with the dengue virus, especially Aedes aegypti. Malaria is primarily transmitted through the bite of an infected female, Anopheles mosquito carrying Plasmodium parasites. Both require mosquitoes as vectors, but the mosquito species and the way the pathogens move through the body are different. So, how does transmission occur in these two diseases? When an Aedes mosquito bites a person carrying the dengue virus, the mosquito can become infected and transmit the virus to another person through subsequent bites. When an Anopheles mosquito bites a person carrying Plasmodium parasites, the parasites develop inside the mosquito and are then transmitted to another person through a subsequent bite. Dengue fever can affect people of any age, but children, older adults, and people living in or traveling to areas where Aedes mosquitoes are common may face a significant risk. Malaria can also affect people of any age, but young children, pregnant women, and people without immunity who live in or travel to malaria-endemic areas have a higher risk of severe disease. Neither disease is limited to a specific age group, but the groups most vulnerable to severe illness are somewhat different. So, who needs to be especially cautious about these two diseases? With dengue fever, the risk of severe disease may be higher in young children, older adults, pregnant women, and people with certain underlying conditions or a previous dengue infection. With malaria, children under 5 and pregnant women are particularly vulnerable to severe complications, especially in areas where malaria is endemic. Dengue fever usually has an incubation period of approximately 4 to 10 days after the bite of an infected mosquito. Malaria generally has an incubation period of around 7 to 30 days, although it can be longer depending on the Plasmodium species. Neither disease usually develops immediately after a mosquito bite, but their incubation periods can differ significantly. So, how long does it take for symptoms to appear after the pathogen enters the body? With dengue fever, symptoms usually begin after about 4 to 10 days, and often appear relatively suddenly. With malaria, the incubation period depends on the Plasmodium species, and in some cases, symptoms may appear after several weeks or even longer. Dengue fever commonly causes sudden high fever, headache, pain behind the eyes, muscle and joint pain, nausea, and sometimes a rash. Malaria commonly causes episodes of fever accompanied by chills and sweating, along with headache, fatigue, body aches, and sometimes nausea. Both can cause high fever and severe fatigue, but the pattern of fever and accompanying symptoms can be quite different. So, how can we distinguish the two diseases based on their early symptoms? With dengue fever, patients often experience persistent high fever during the first few days, accompanied by headache, pain behind the eyes, muscle and joint pain, and sometimes a rash. With malaria, episodes of fever may be accompanied by chills followed by sweating, creating characteristic fever patterns, although the actual presentation can vary from person to person. Dengue fever usually begins quite suddenly after the incubation period, with high fever and noticeable symptoms appearing during the early stage. Malaria can also develop rapidly when the parasites begin destroying red blood cells, often causing episodes of fever accompanied by chills and sweating. Both can cause a person to go from feeling normal to experiencing fever and fatigue within a relatively short period, but the course of illness can be very different. So, how does the progression of dengue fever compare with malaria? With dengue fever, the illness usually begins with a sudden high fever and can progress through distinct phases. The critical phase often occurs around the time the fever begins to subside. With malaria, fever episodes can occur in cycles, often beginning with chills, followed by high fever and then sweating. Without treatment, infections caused by dangerous Plasmodium species can rapidly progress to severe malaria. Dengue fever often causes intense headaches, particularly with pain behind the eyes, along with significant muscle and joint pain. Malaria can also cause headaches, body aches, and fatigue, but these symptoms often occur together with episodes of chills and fever. Both can cause headaches and widespread body aches, but the intensity and pattern of these symptoms can differ. So, how can we distinguish the two diseases through these types of pain? With dengue fever, headache and pain behind the eyes are often prominent, accompanied by muscle and joint pain that can make the entire body feel extremely sore. With malaria, headaches and muscle aches often occur alongside episodes of fever, chills, and sweating, creating cyclical attacks in some cases. Severe dengue can cause major bleeding, plasma leakage, shock, organ failure, and in critical cases, death. Severe malaria can cause severe anemia, impaired consciousness, seizures, respiratory failure, kidney failure, and damage to multiple organs. One can cause blood vessels to leak and lead to shock, while the other destroys red blood cells and can directly affect the brain and multiple organs. So, how dangerous can the complications of these two diseases be? With dengue fever, the critical phase can occur when the fever begins to subside. At this point, plasma leakage, bleeding, or organ failure can develop rapidly. With malaria, particularly malaria caused by Plasmodium falciparum, the disease can rapidly progress to severe malaria, causing brain involvement, severe anemia, kidney failure, or multiple organ failure if treatment is delayed. Dengue fever resolves on its own in many people, but some cases can progress to severe dengue and become life-threatening. Malaria can become extremely dangerous without early diagnosis and treatment, especially when caused by Plasmodium falciparum. Both diseases can be fatal, but the level of danger depends on the form of the disease, the person's condition, and how quickly treatment is provided. So, which disease is more dangerous? With dengue fever, the greatest danger usually occurs when the disease progresses to its severe phase, causing shock from plasma leakage, severe bleeding, or organ failure. With malaria, severe disease can progress rapidly and cause brain damage, severe anemia, kidney failure, or multiple organ failure if treatment is not provided promptly. There is currently no specific antiviral treatment that eliminates the dengue virus, so care mainly focuses on rest, adequate fluid intake, and close monitoring for warning signs. Malaria has specific medicines that target Plasmodium parasites, and the treatment regimen depends on the parasite species, disease severity, and patterns of drug resistance in the region. One mainly relies on supportive care and symptom management, while the other has specific drugs that target the pathogen. So, how do the treatments for these two diseases differ? With dengue fever, patients are usually monitored for dehydration, platelet levels, and warning signs. Severe cases may require hospitalization for intravenous fluids and organ support. With malaria, patients need appropriate anti-malarial medication. Severe cases may require emergency hospital treatment and injectable medication. Preventing dengue fever mainly involves avoiding bites from Aedes mosquitoes and eliminating mosquito breeding sites, especially containers and areas with stagnant water around the home. Preventing malaria focuses on avoiding bites from Anopheles mosquitoes, using bed nets, insect repellents, and mosquito control measures in areas where malaria is endemic. Both diseases can be prevented by avoiding mosquito bites, but effective prevention requires controlling different mosquito species and environments. So, what can we do to protect ourselves? For dengue fever, people should keep water containers tightly covered, eliminate standing water, maintain a clean environment, and use mosquito repellent or long clothing to reduce the risk of Aedes mosquito bites. For malaria, people should sleep under mosquito nets, use insecticide-treated nets when appropriate, apply insect repellent, and take additional mosquito control measures when living in or traveling to malaria-endemic areas. Dengue fever has a low case fatality rate when detected early and treated appropriately. The World Health Organization states that the case fatality rate can be kept below 1%. Malaria carries a much higher risk of death when it becomes severe and treatment is delayed. In 2024 alone, malaria caused an estimated 610,000 deaths worldwide. One usually has a very low fatality rate when properly managed, while the other remains a disease responsible for hundreds of thousands of deaths every year. So, How large is the difference in mortality between dengue fever and malaria? With dengue fever, most people recover, but severe dengue can cause shock, major bleeding, and organ failure if it is not treated promptly. With malaria, particularly Plasmodium falciparum malaria, the disease can progress extremely rapidly to severe illness and death if treatment is not started early. The future of dengue prevention is moving toward more effective vaccines, technology-driven disease surveillance, and mosquito control strategies to reduce transmission. The future of malaria prevention is increasingly promising, with the RTS, S, and R21 vaccines, along with new approaches designed to reduce infections and deaths. One is still focused on controlling the virus and its mosquito vector, while the other has entered an era in which vaccines are already being widely deployed. So, how could the future change the fight against dengue fever and malaria? For dengue fever, vaccines are available in some settings, but further research is still needed to optimize their protective effectiveness, while mosquito control, disease surveillance, and new preventive strategies remain key priorities. For malaria, the RTS, S, and R21 vaccines have been recommended by the World Health Organization for children in malaria endemic areas, and expanding vaccination coverage could significantly reduce severe disease and deaths in the future.